How to know a fertile man, or how to know if you as the man you are fertile. Yeah, I've come again with my talk. Now, one out of every three cases of infertility is due to male factor. But we don't have conversations like this because somehow we have made the topic of fertility to be about women. So when you see couples that are yet to give birth, everybody's looking at the woman. Oh, what did she do? Or maybe she had an abortion. Oh, blah, 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 forgetting that it takes two people to actually make a baby. So sometimes it may not be the woman's fault. It may be the man. Okay, so male fertility is basically about healthy sperm. Okay, the more healthy your sperm is, the more fertile you are. The unhealthy your sperm is, the infertile you are. All right, now I'm going to give us a few tips or few signs that show that a man is fertile, or that his boys down there are working, or that his boys are working and are eligible to score a goal. Okay, let's put it like that. Number one is healthy ejaculation. Yes, healthy ejaculation. As a man, please pay attention to what you are ejaculating, what is coming out when you're ejaculating. The semen is important. What's the quantity? When it comes to male fertility, both the quantity and the quality are important. Okay, the quantity, what is the amount of semen that you're ejaculating? A healthy man's semen should be from 1.5 mils to 5 mils. Exactly, it's a small amount, but some people don't ejaculate up to that. It might interest you to know. Yes. Now 1.5 to 5 mils is like the from like half to the full cover of the cap of a water bottle. Yeah, not water bottle, water can, all these plastic cans. Yeah, the cover. Okay, so half of it to full of it is about 1.5 to 5 mils. So if you're not ejaculating up to that, then there's a problem. Some men ejaculate and what is coming out is just droplets, just be dropping like breast milk. No, that's not healthy. Okay, you may want to look into that. And then the quality too is important. If you're ejaculating and you're ejaculating well, maybe you have up to 1.5 to 5 mils, and what you're ejaculating is watery, or is yellowish, or is off white. A healthy sperm is white in color and slightly thick. Okay, it's not very thick, but it's not equally watery. It's like the pap, the concentration of the pap they give babies. Exactly, not too thick, not too watery. So yeah, that's what a healthy semen should look like. So when you're ejaculating as the man, please note these things. Check to know if your boys down there are doing their work. Okay. Now, the why your ejaculation is important is that the quantity of semen that you are going to ejaculate is a determinant of your sperm counts. Okay, so your sperm count is the number of sperm you produce per ejaculation. Ideally, a man is supposed to produce about 15 million spermatozoas. You heard me, 50 million. Okay, because the lifespan of the sperm is very small. Okay, so you need more of it to get to work. You need more of it to get to the egg. Okay, so if you have, imagine you have a battle that 50 million people are supposed to fight, and then you can produce only maybe 2 million or 3 million. You're already losing that battle. Okay, and it will show. It shows in your ejaculation. It shows in what your semen is producing when you're ejaculating. Because if you are producing droplets of sperm, that means you're not producing enough. Okay, so that's one point. And number two is hormonal level. The male hormonal level simply refers to the testosterone. The testosterone, imagine the testosterone as the fuel of sperm production. Okay, that you're producing enough sperm means that you have normal hormonal level. That is normal level of testosterone. If you're not producing enough sperm, means that your testosterone level is probably low. All right. Now, your testosterone is important because that is what fuels your sperm production. So, if you have normal level of testosterone, then of course your sperm production is going to shoot up and it's going to be normal. But if you don't, it's going to affect your sperm production. Testosterone is not just about giving men the deep voice and the muscles. It's equally about sperm production. And there are few ways that you can decipher if the testosterone level is okay without necessarily carrying out the blood test. However, carrying out the blood test is the one solid valid way to know. But check out a man's hairs. Men are supposed to have beards and kind of hair in their body. Testosterone is responsible for that in men. That is why women don't have beards on their faces and all of their bodies, because even though they have testosterone hormone, but it is lower. Okay, so you don't expect to see a woman, even though there are some women that have, of course, those are the exceptions, but ideally, a woman is not supposed to have hairs and all of that, because she's supposed to have a higher level of the female hormone, which is estrogen, over the testosterone. Now for men, they have more of testosterone than the estrogen. So if as a man you're having, I mean, that doesn't mean you should be so hairy or no, but I mean, you have hairs, your side jars are growing, you have hairs here, you have that. Okay. Yeah, it could be a pointer that your testosterone is doing well. And then you sound like a man. Some of you don't sound like men, you sound like girls. Okay, that's on a lighter note though. But yeah, deep voice. The testosterone is responsible for the deep voice too. So if you're a man, you are healthy, and you have relatively reasonable amount of beards and hairs on your body, and then you have the masculine voice, the muscles and all of that, it could be a pointer that your testosterone level is okay. But that is not the only pointer, please. Okay, you may equally want to go and get yourself checked out, and you may maybe carry out a test. All right. Now the number three pointer to a fertile man is absence of chronic conditions. All right, you don't have diabetes, you don't have heart problems, you don't have uh um varicocele. Yeah, that is swelling around the scrotum and the veins of the scrotum, and you don't have inflammation around there. The boys are healthy, there is no pain, there is no swelling, you don't have any medical condition per se. All right. So these are signs to look out for. These are signs that can tell you that, okay, that, I mean, your boys are doing well. But ultimately, the ultimate sign is your semen analysis. All right. So if you notice any of this, if you notice that it's not really there, or you are in doubt, you may want to carry out semen analysis. Okay, because you need your sperm to be healthy in order to get a woman pregnant. There is no two way. See, look at the reproductive process as a race, as a relay race, where the eggs, that's the feminine egg, is at the finish line, while the sperm are the runners. Okay. Now, if the runners are too slow, too weak, and easily lost on the road, they will meet up with the egg. However, remember that the egg is not there forever. The egg is only there for a period of time, after which, if you wait for sperm and it doesn't see any sperm, it's going to melt, it's going to dissolve and leave the woman's body. That is menstruation. Yeah, it leaves in form of blood. So, whilst you're trying to get a woman pregnant, you need your sperm to be healthy. So please, if you notice any of this, you may want to go get checked out. All right, and that is not to say that if you notice that you have healthy ejaculation, your hormonal levels are okay, and you don't have any chronic condition, that does not mean that if you want to get married and your wife is telling you let's go and do semen analysis, you come and tell them that someone said that once you have this, that means you're okay. No, please, still go ahead and do your semen analysis. Okay, but this could be few pointers, because some men, men, they like to max things up and act like, I'm fine, I'm okay. They'll just be using math to be overcompensating. Some of them deep down want to know if they can really get a woman pregnant, and that's why you find out that most times men say things like, oh, if she's not pregnant for me, I'm not going to marry her. It's not just about knowing if the woman is fertile, it's equally about him and his ego, knowing if he's able to get a woman pregnant. All right. So, while you're doing that, yeah, I mean, instead of doing that, you can just use these few signs to know if your boys are working, or you need to visit a doctor. Okay.